For more on Cuba's COVID response, let's bring in Rafael Perez-Escamilla, Professor of Public Health at the Yale School of Medicine. Welcome back to the show.
Thank you, Rachelle.
So let's first start with the key ways that COVID has really impacted the Cuban economy and the livelihoods there.
So as you can imagine, Cuba has been facing for many years and continues to face a very harsh economic and trade sanctions. So in addition to all the major economic pressures they already had within the country, obviously the COVID-19 pandemic came at a really bad time to actually worsen even more the economy and the access to basic goods for the Cuban people.
Now, obviously, we're going to get to Soberano 02 there, obviously a huge development. Where do things stand with Cuba's COVID response, the testing and the treatments at this point?
So Cuba has a very long and very successful track record with the development of vaccines. Cuba not only produces 8 of the 10 vaccines routinely used in the country as well as in many other countries, but they have also managed to export hundreds of millions of doses abroad. So the biotech industry from Cuba that has been able to successfully sustain their vaccine program has actually been an important part of the Cuban economy. So if everything goes well, as we expect, there are no reasons why Soberana is not going to work as well as Sputnik or the Chinese vaccine, then I think it may be the beginning of hopefully a new opportunity for the society in Cuba to contribute to the well-being not only within the island nation, but also throughout Latin America and hopefully low-income countries all over the world.
We certainly hope so. So then in terms of Soberano 2's funding and distribution plans, what do we know so far and what sort of support may they need down the road?
Yeah, so the main issue that Cuba is going to face with regards to the ability to actually distribute vaccines, not only within Cuba, but actually to be able to export tens, if not hundreds of millions of doses, is going to be the fact that the economic sanctions, the economic blockade, may prevent them for having access, for example, to the glass vials that are needed to package the vaccines. So I would say that this is really the time for all Latin American countries, all the countries in the Americas, to forget a little bit about political ideologies and put the public health of the people of the world first. At the end of the day, no other country in Latin America has been able to do with regards to the COVID vaccine as Cuba has done. And it is very, very possible that if those sanctions are eased, Cuba will have the capacity to produce and export the much needed vaccine in very large numbers, especially in the more than 140 countries, low-income countries that have where not a single person has been vaccinated yet.
And as we know, Cuba is saying that it's open to vaccinating tourists with its Soberano 2, another way to bring in revenue. What do you think of using this tourism tool, especially for such a popular vacation destination?
Why not? I think it's actually a very good idea. I like to think about an approach to tourism that is safe from a public health perspective. I believe there are 3 doses of Soberana that people are going to need, so they are willing to give all of them for free to tourists, and so that they don't have to stay for weeks and weeks on end in the island. They can take their first shot while in the island, and then they can take the 2 additional vials back to where they came from. So I do think it is a good idea. I think Cuba, as any other country in the world, is entitled to actually help boost their economy, their tourism industry in a safe way, if they have the capacity to do so with a vaccine. For example, in Cancun, in Mexico, many luxury resorts are offering free testing to tourists every day, several times per day if they want. So I do think it is a reasonable measure for a country that very, very badly needs to get back some of their tourism revenue.
Well, thank you. It's always good to talk to you. Rafael Perez-Escamilla there, Professor of Public Health at the Yale School of Medicine.